So what we've been able to do is to pinpoint where these disturbances are in the brain, and we've been able to intervene within these circuits in the brain to either turn them up or turn them down. So this is very much like choosing the correct station on the radio dial. Once you choose the right station, whether it be jazz or opera, and in our case, whether it be movement or mood, we can put the dial there, and then we can use a second button to adjust the volume, to turn it up or turn it down. So what I'm going to tell you about is using the circuitry of the brain to implant electrodes and turning areas of the brain up and down to see if we can help our patients. And this is accomplished using this kind of device, and this is called deep brain stimulation. So what we're doing is placing these electrodes throughout the brain. These are, again, we are making holes in the skull about the size of a dime, putting an electrode in, and then this electrode is completely underneath the skin, down to a pacemaker in the chest. And with a remote control, very much like a television remote control, we can adjust how much electricity we deliver to these areas of the brain. We can turn it up or down, on or off. Now, about 100,000 patients in the world have received deep brain stimulation. And I'm going to show you some examples of using deep brain stimulation to treat disorders of movement, disorders of mood, and disorders of cognition. So this looks something like this when it's in the brain. You see the electrode going through the skull into the brain and resting there. And we can place this really anywhere in the brain. I tell my friends that no neuron is safe from a neurosurgeon because we can really reach just about anywhere in the brain quite safely now. Now, the first example I'm going to show you is a patient with Parkinson's disease. And this lady has Parkinson's disease, and she has these electrodes in her brain. And I'm going to show you what she's like when the electrodes are turned off and she has her Parkinson's symptoms, and then we're going to turn it on. So this looks something like this. So the electrodes are turning off now, and you can see that she has tremor.
But the right inside.
Okay.
I can't.
Can you try to touch my finger? That side's a little better.
That side is better.
Right.
We're now going to turn it on. It's on.
I just turned it on.
And this works like that, instantly. And the difference between shaking in this way and not is related to the misbehavior of 25,000 neurons in her subthalamic nucleus. So we now know how to find these troublemakers and tell them, gentlemen, that's enough. We want you to stop doing that. And we do that with electricity. So we use electricity to dictate how they fire, and we try to block their misbehavior using electricity. So in this case, we are suppressing the activity of abnormal neurons. We started using this technique in other problems. And I'm going to tell you about a fascinating problem that we encountered, a case of dystonia.